Hi, and thanks for joining me. This is the show where regular people like yourself get to share real experiences and insights about pain and life. In these casual conversations, we're usually talking about a type of pain that strikes from out of the clear blue, while we're just living life, often doing everyday things that we've done with no problem before. But for some reason, one day, the body suddenly decides it's just had enough. I'm your host, Yaling Liu. I'm a chiropractor, and some of these guests are my patients. I've been working with bodies in pain since 1994. And one of my favorite parts of practice is still the time I get to spend connecting with people about life as it relates to their pain. Some of the most significant breakthroughs that I see in practice happen through conversation. It's during these frank discussions that we often stumble upon realizations that can help us move forward. And this is exactly why I want to share them with you here.
You're just doing what you should, doing what you should. You're just doing what you should.
As usual, these conversations start with the topic of pain, but where they lead is always unique in some way. So far, each of my guests are always happy to share and contribute, but they do seem initially a little surprised that I want to hear and share their perspectives. I think for most of us, when we're preparing to tell our story, it makes us immediately question the significance of our own experiences compared to those of others that we might think are much more interesting. Oddly enough, this made me think of how almost the exact same thing often happens when people come to see me for help with their pain. A lot of us question the significance of our pain. We're either a bit embarrassed to be seeking help in the first place, or we're embarrassed by our concern or worry about the pain. I think this comes from assuming that others have it much worse than us, and therefore they have a more legitimate need for care than we do. It's really hard to be objective about our pain perception. There's so much judgment and confusion about it. The variability in our individual pain perception is one of the things that keeps me really interested in my work. I'm always intrigued by the endless spectrum of sensation experience, and yet our language for pain is extremely limited. Sometimes part of my job is to use facts, findings, and my experience to reassure patients that their pain is not as serious as it feels. Minor pain can become much worse when we're stressed and afraid, and the behavior informed by fear can prolong that pain, which is a very common reason for persistent pain. Other times, I have to use those objective facts and findings to help people take their pain more seriously so that they can stop unknowingly making it worse. These are actually the most complicated cases, in my opinion. They can easily turn chronic because when pain is disregarded and pushed through repeatedly for long periods of time, it changes the brain's relationship to pain. And giving feedback about it to the healthcare team becomes extremely difficult for the patient whose relationship with pain has resulted in warped pain sensation and altered brain signaling. This makes it also very difficult to interpret for someone like me who is trying to help. Knowing how to appropriately scale assessment and care of a patient with chronically ignored pain like this becomes a bit of a guessing game, informed only by practitioner bias. Pain and illness perception is a really big problem in healthcare. If we as patients seek help assuming that others generally have it worse than us, and we're probably just being big babies, then we often don't get the care and attention we need and deserve because we go into it downplaying our symptoms and concerns, which gives others permission to dismiss us. On the other hand, if we present with urgency, we often still won't get the care we need because then we risk being perceived as potentially exaggerating or worse, hysterical. So as I sit down with people for these podcast episodes, if I hear someone undervaluing or even just questioning the value of their experiences, thoughts, and feelings, it makes me think about what happens when we show up in the doctor's office with this same core belief that others may be in more significant need or more deserving of attention. And it's true, there are comparatively a lot of much more dire situations out there, and remembering this can be calming. But does this effort at calming yourself unintentionally signal to the provider that they can gloss over you because you seem so fine? Or, if you're not calm, does your undercurrent of worry subconsciously signal to the provider that your primary problem is worry and not actually pain and illness? As you listen to today's episode, consider some of these questions. Specifically, how do we embrace the notion that our story has value, that our experience is valid and deserves attention? Through these conversations, I think you'll see that each of my guests, including today's, ends up having valuable life insight, even though they may not always realize it. I just want you to remember these people are just like you. Their healing path started or restarted at some point with feeling cared for. And that includes feeling heard and respected, not minimized or dismissed. Let's listen now for more unassuming insights by someone who comes at it both as a patient and a practitioner.
I'm an acupuncturist and a contemporary movement artist.
This is Paige. At the time of this interview, she was just at the start of her journey into clinical acupuncture practice, and you'll hear her make reference to her time in school, since it was such a fresh memory still. For many of us, these intensive stints into higher education can be a real test of our relationships and overall stress coping. She comes to this conversation with decades of experience using her body in the dance and performing arts, where showing up and persevering are highly valued.
Dancers are often in pain and athletes and anyone who's working with their body, unless it's really a huge injury, they have to keep performing. They have to push through it a lot. And so you learn to push through your pain, which is a whole nother topic around, health and how that hurts the body and mind, and just culturally too, how that's really valued. I don't think it's healthy to do. I mean, yeah, I've pushed through. And for what? I'm like, why did you do this, Paige? It wasn't like I even did it. I wasn't even on at the Moore Theater. I don't know. Or I was like, no, I was in this funky experimental art space with a concrete floor for an audience of 10. And I gave myself whiplash just because, because I was like really in the moment and I was really committed. And that was actually kind of scary. I think I really hurt myself. Right after the performance, I was talking to someone and I started to have this kind of nausea, dizziness, a little like disorientation, and I couldn't stand. Like I thought I was going to maybe faint or something. And I was like, I have to go lie down. I think I really hurt myself. And so I went and I lied down, just like supported my neck, but I just needed to be lying on a flat surface with my back and no movement, and just let it calm down, whatever happened. Yeah. And then I got up and I couldn't move my neck. I had given myself whiplash if I put it slightly forward or anything, and I just had to stay in a complete, neutral spine.
Yeah, wow. Do you push through your pain? If you do, you're not alone. But have you thought about whether or not it's a conscious choice that you're making? Or have you unknowingly, like many of us, bought into the social messaging that is all over our pop culture and media? Have you noticed how advertisements for over-the-counter pain medication is basically telling us to not listen to our bodies? Because if we do, we'll be that sad reject in the corner missing out. Numb your pain and you will be a hero. You'll win the war on pain. What's ridiculous is that everyone in real life is so busy being afraid of missing out and falling behind the tribe that we're all just running ourselves ragged, competing for some sort of imaginary or mythical ideal. I don't know about you, but I find myself really bothered by the battle metaphor in healthcare. How often have you heard about fighting the pain or waging war against a disease? What if we embrace these pains and disease messages and treat them like they're an important part of us? Pain is a part of you. It's a way to tune in and refine your body's needs, not an enemy that needs destroying. I guarantee you the pain messages will just become stronger and louder until they're so disruptive that you have no choice but to pay attention. Here's how Paige's body got her attention a little while back.
My first year of school, had crazy nerve pain, pinched nerve radiating down my arm. Even though I've had other injuries, but that was the most extreme because I couldn't get into a position that alleviated. Nothing really did. And if anything, lying down made it worse, which was impossible. So I couldn't really sleep. So I had to be in this upward position, but it was just chronic pain. But it was for about 2 weeks, like at a really high level pain that I couldn't really function. And I was just so miserable trying everything.
Wow.
And after the beginning of the whole series in my education, I was like worried about it, and I'm tracking it and I'm worried about it. Well, is this just I think this is just in my life. And I'm okay. And there's like a level of acceptance, and it's not bothering me. I don't think impending, hurting other structures or something's wrong inherently with my body. If you have these little things that are, you can tell that are not optimally functioning.
Paige was no stranger to body pain and so used to it that what finally got her attention had to be pretty unique. Something that gets worse with rest would be hard for anyone to ignore. As you may know yourself, the first time with an unfamiliar kind of pain can feel really alarming. But from my perspective, Paige's history of neck and arm pain made a lot of sense, partly because of what she was doing with her body through dance for many years, but then also from the demands of being a student, which ironically include almost the exact opposite kinds of stress, more stillness than activity. Paige's body went from one extreme in movement to the other extreme. The contribution of activity or lack of activity is only one piece of the pain puzzle, however. All pain has 3 contributing components to it: mechanical, biochemical, and emotional. Mechanical is all about positioning and movement. Biochemical is all about stress at the cellular level. Emotional contributions of pain and injury happen because of the influence our state of mind can have on our body chemistry. Things like stress and worry, which includes obsessive thinking, are all big factors.
Kind of seeing that these things that are going on and not trying to put a grave attachment of importance to it and value to it to have it interrupt your daily function and your mindset.
Right.
I do think, I agree. I've worked with people where I can see that the obsessive thinking over their illness and their definition of it is debilitating them. Just their thought process is I feel feeding the fire of what's going on.
Yeah.
And then it's just like we're on the spectrum. And then of course there's other people who are completely not connected and
to their detriment.
To their detriment. We have these imbalances, and just focusing on those imbalances is so much a part of the suffering.
Mm-hmm.
That's so much a part of the suffering when you're looking at a tree and seeing all the different ways that a tree grows and the irregularities that we find in nature, and we're very irregular.
I love the thought of embracing the crooked but beautiful and functional tree that we each are. Each bump in our bark or turn that our branches have taken are that way for a reason. The human body adapts very much like a tree does. Have you ever seen those novelty images of tree trunks with foreign objects like bicycles sticking out of them? The tree just grows around it and keeps doing its thing. That's the ultimate adaptation. But here's a question for you. If you're more accepting of your aches and pains, does that lead to prolonged complacency? An inadvertent neglect of pain that should be getting your attention? Or does acceptance soothe the emotional strain of worry so that you can better tell what's important and keep moving when movement is restorative? It's a really fine line, and I think it depends where you are on the spectrum in the process of learning to listen. If you've ignored your pain for years, then you really need to work on listening to the subtle signs, which might feel almost ridiculously melodramatic to someone like you. If you have a worrying streak in you and tend towards anxiety, then it's important for someone like you to find a way to listen without panicking. Get some level-headed professional input to help you put your pain into a non-alarmist context to better know when it's okay to push through it a little bit, which it often is. New research is showing that if you can find someone who can show you safe and pain-free movement, you can reset your worry meter and should be able to move forward better.
It's good to know diagnosis is good, but it also can be really bad.
It's true.
It can really box someone in and
yes,
I have this, I am this, now I am this, and that's painful to watch. And then it also reflects back on me, my own ways in which I define my pain.
Labels are interesting. We need language labels to help us understand ourselves and the world around us. But Paige is right here. It's easy to start seeing our pain condition as who we are. If we identify too closely with our pain, it becomes part of our persona, and then how can we ever expect to shake it? At the same time, I see examples every day of how labels and diagnoses help patients get better. It puts a tangible concept to a potentially overwhelming situation and creates a roadmap out of it.
I do have low back pain, and I don't know. I just kind of accepted it, and I don't try to work on it.
Does that mean you're actually experiencing less pain because of the acceptance, or are you experiencing less pain?
And also that process, I don't know. I have aches and pains that I know are there, and I hear them a lot. And then I'm just like, okay, I don't think you're dangerous, so you're fine. Shh.
Other things take precedence.
My left hip, that really kind of surprised me because I guess I get kind of shaken a little bit when it affects your everyday movement. Mm-hmm. Oh, I can't really walk so easily to the treatment room to help someone. I had this and I was grateful to start a trade with an acupuncturist, and then it kind of helped me. But I just remember coming to her a little bit in tears. I'm like, my whole body hurts. Like it just hurts. Like everything was, that was recent. I mean, that was like maybe 2 months ago. I had abandoned some of my regular things, my managing things, and also I'm working with some digestive stuff. Yeah. So I've been having a lot of abdominal pain, which is also really uncomfortable.
Here's something that I see regularly, and you may have heard me talk about it before. The correlation between lower back pain and abdominal distress is real. Both constipation and diarrhea can contribute to either mechanical or chemical stress in the lower half of the body, to the point where the lower back starts to suffer. Is it the inflammation that spills over from the front to the back? Or is it the stress of the tension created by abdominal bloating that tugs mechanically on the lower back structures, making them pull back in a tug of war of sorts? There's no way to know for certain, but next time you have any prolonged abdominal discomfort, check in and ask yourself how your lower back is feeling. Or, if your lower back is mysteriously sore, check in with how things are going with your belly. And what is it that's causing abdominal discomfort for Paige?
So, I mean, I have what they call SIBO, small intestinal bacterial overgrowth.
Some of you may know what this is. Awareness of this condition has been around for a while, but it is recently experiencing a surge in publicity. And we'll delve more into this diagnosis and what it is a bit later in the episode. In the meantime, let's keep uncovering all the different things Paige has trained her body to intermittently put up with.
That neck injury, that was the most severe, where, oh my God, everything has to stop.
Does this go back to the whiplash, nausea, dancing incident, or even before that?
It did happen before that. But I'm sure I've always had, like, this is like where I hold. I just feel if I'm thinking a little harder, I just feel the fibers start to come together. and then I've done stuff like give myself whiplash. So I'm sure it all just started to compound in one little spot.
Okay, yes. Paige had her run-ins with whiplash injuries, but the phenomenon of holding stress in the body is a real thing. There's a neuroscientist named Candace Pert, who actually sadly died not too long ago. She was one of the first people back in the 1980s to find scientific evidence of the connection between body and mind. She uncovered something called the psychosomatic network of proteins, specifically neuropeptides. Neuropeptides are signaling molecules that neurons use to communicate with each other, and receptors for these molecules are found all over the body. This makes for an elaborate biological signaling system that communicates to all sorts of body tissues information about our state of mind, which is actually just a complex readout of what your nervous system is doing. Or if you want to get really specific, your neuroendocrine system, because hormones are a significant part of the picture too. When Paige refers to the connection between thinking just a little harder and feeling a resultant physical tightening of her neck, she's describing the practical experience of this biological phenomenon that links feeling and thought with physical experience like pain and tension.
And then I went to school and I had a really stressful quarter. I did really well though, but just because I was stressed out. And then, so school's over. I've just put my body through a lot. Okay, I'm just going to drink a lot tonight. and totally party. And after that, I woke up and I was like, oh, I have a little kink in my neck. Oh, no big deal. It'll just work itself out. I'll just like take a bath. I'll lay on it. And it just got a little bit worse and a little bit worse and a little bit worse. And the next thing I know, I have this locked and radiating.
This is actually a great example of a biochemical pain trigger, but in an unexpected way. It's definitely possible to irritate our body tissues chemically with emotional stress. But when we are doing something that feels fun and easy, like eating, drinking, and relaxing late into the night, it seems kind of ridiculous for that to result in pain, but it can and does. The verdict, according to the science, is that alcohol can be both inflammatory and anti-inflammatory, depending on many different factors. The bottom line is all about alcohol's impact on the liver and nervous system. The liver considers alcohol to be a high-priority toxin, and it'll drop everything it's doing just to deal with the alcohol first. When your liver is busy, it can't help you to break down and dispose of other toxins like the byproducts of normal, everyday metabolism, and when that backs up, it can irritate body tissues and causes pain. Alcohol's effect on the nervous system, on the other hand, is such that inhibitions are less. You probably have heard of or maybe experienced the effect of alcohol in the system when falling or stumbling while tipsy. The impact seems less intense because our body is less tense and guarded. But when we sleep after drinking, sometimes we sleep so hard that we don't move around as much as usual, and you might find that you wake up in the same exact position that you fell asleep in. This can contribute to body pain and stiffness, just like what Paige experienced. So, between the inflammatory merriment and the hard sleep that followed, this was the perfect recipe for waking with a stiff neck, which was already her vulnerable area. This next part of our conversation reminds me that before there was neuroscience research by people like Candace Pert, linking emotions and pain in a real physiological way, the term psychosomatic used to be code for it's all in your head, it's not real pain, it's just your anxiety. With the help of research like this, though, I think attitudes about it are largely changing. But Paige makes me realize that maybe it's not happening as quickly as I would like to believe.
I think there's something about, and this happens, and I don't know if it's something that happens to women more, I'm sure it does, people who are hyper body aware. Practitioners don't take you as seriously. They think somehow, like I'm exaggerating. No, it's really hurting. But I feel like a lot of things when I go, because I'm like, well, this is happening and this is happening. It's not taken seriously enough. Like my pain in my ovary. I'm like, I think I have this thing. They look at me and they're like, oh, well, you look kind of healthy.
Mm-hmm. Separate from the everyday variety of neck pain, Paige had an experience with a gynecological issue that started with what she remembers feeling like a tugging sensation in the lower abdomen. And she also remembers noting that it didn't feel quite right. It was out of the ordinary, so it stood out to her. She was assured by her gynecologist at the time that there was nothing detected on palpation, and ultrasound imaging was an option, but because it didn't seem urgent to the doctor, and frankly, she did not have health insurance at the time to pay for it, she just forgot about it. Then months later, while she was busy with school, she developed very uncomfortable symptoms similar to a urinary tract infection. And those kinds of symptoms include burning at the urethra, pain in the abdomen, and the feeling like you have to pee all the time. She went to the doctor who supposedly tested her but reported no positive test findings. She was told to go home and basically wait and see. Time goes by, the pain doesn't go away. She waited a month, way longer than I would have endurance for. Finally, she went to see a third doctor.
And the woman came back and she's like, you have a serious UTI, my dear. And I burst into tears. And I just this thing about listening to your body. And I'm like, I knew I had a UTI, And she's like, yeah, you have a raging UTI. And when she was palpating, she's like, I feel a small mass, but you're very irritated. So come back after this has calmed down. She came back. She's like, I feel something. You go and get an ultrasound. And then by this time, it's big.
Yeah.
It's really big.
Right.
It's really big and it needs surgical removal.
Paige knew almost a year, if not longer before this, that something was not quite right in her pelvis. But it took that raging infection to catch the attention of a third doctor. Paige explains that like many other people who tolerate a lot and have busy lives, by the time she decides to go to a practitioner for help, she has a long list of issues. And is it the long list that is off-putting to some doctors? Or maybe it has to do with being very aware of all of her body sensations like some people are. That makes it hard for doctors to understand that she's not exaggerating.
Because I do have someone who comes in and she's listing things. This is a lot, but I think this is all very real. And also, I think you have to, but it's also, you have to regardless. It's like, who are you to say that is real for them? That's what their experience is. Right. Their experience is at a 9 out of 10. And maybe I'm over here looking at them and maybe I could say internally, I don't think it's that bad. But
right.
But you're like, oh, you have to meet the person where they're at. And I think you have to say, okay.
Sounds like now you take your pain more seriously. So maybe you can convey that better. But back when you couldn't.
Well, I know. Well, now you're making me realize because it was something when I went to the naturopath at Bastyr. Well, I've been having this digestive discomfort and I think something's there. Something is going on. This is weird. I don't think this is normal. Like, yeah, I'm like waking up in the middle of the night, serious cramping. It's really hurting. It's really bloated. And he's like, okay, well, let's just take a diet diary and see how it goes. Okay. And then I'm like, I kind of want some tests. Isn't there some test, something? Can she run some blood work, something? And he was very, reserved. And then the next time I saw him, I'm like, okay, still happening. And he looked at my diet diary and he'd go, oh, okay, well, there's this, it is pretty erratic pattern. So, I would either think H. pylori or potentially SIBO. He's like, but I'm kind of not really feeling either one of those. I wasn't expressing to him a severe enough case to even warrant testing for both of them. And now that I'm getting to share this with you, here I am again, but I didn't. But at that time I was like, let's do the SIBO test. No, let's do it. And then he was like, okay, well, let's think about it. Sometimes it's not covered by, I'm like, it's okay. Let's do it. I want to do it. And he like went away and I looked on my phone and I read about it and I'm like, this is what I'm experiencing. And he came back and I was like, I just read about it and that is what I'm experiencing. Yeah, I want to do this test. Doctors get mad now when people are reading stuff online. And then he was surprised. He's like, oh, yeah, you have it.
SIBO, as was mentioned earlier, SIBO, it's an acronym that's short for small intestine bacterial overgrowth. It is one of the underlying causes for the umbrella diagnosis of irritable bowel syndrome. It's a condition that presents like many other GI problems, painful bloating, diarrhea, sometimes constipation, but SIBO often occurs after abdominal surgery and in women over 40. It's very often preceded by a bout of slow motility, in other words, constipation. It can also be associated with a short course of opioids, which is common after abdominal surgery, as is constipation because of the routine opioid pain medication that's prescribed for recovery. It's worth noting that Paige's onset of SIBO did follow abdominal surgery. She opted to have that cyst removed, and somewhere between 6 months to a year later, the abdominal symptoms started. H. pylori, which is the other condition that Paige's naturopath mentioned, is a common cause of peptic ulcers. The interesting thing about this is that more than 50% of people globally have this bacteria, and most people never actually have signs or symptoms. While it also can cause similar symptoms like bloating and abdominal pain, it's more likely to cause a burning or a stomach ache when the stomach is empty. Apparently, this was not exactly what Paige had going on. Let's see what other thoughts this diagnosis of SIBO brought up for Paige.
You just need to do these things and like self-care is so important.
Yeah.
It's so important. And it's hard. It's a lot of work to take care of yourself. I mean, with sleep and eating regularly and exercise and not engaging in dramatic relationships and
yeah,
or of any kind. I don't mean that just like romantically, but just not engaging in
other people's junk, right?
Stuff that's going to create an stress inside of your own and letting things, okay, I'm going to walk over here now to this place that feels more nurturing.
Yeah.
Those are all really hard.
They are.
This idea of avoiding drama really speaks to the importance of emotional stress and how it can significantly contribute to body pain and inflammation. I can't tell you how many times someone comes to see me for care during the acute phases of a pain flare-up, which happens to coincide with a personality conflict at work or at home, during a contentious divorce, or maybe the death of a parent, followed by conflict among siblings. Do any of these emotional stressors sound familiar to you? What did your body feel like when you went through something similar in your life? There's no way we can go through experiences like this without feeling it in our body to some degree. And that may hit us later, after the stress is over. But just because there's a delay doesn't mean that it's not related. If nothing else, one thing that is always true is that pain causes change. We're often forced to change our behavior and sometimes our perspectives too.
Different pains create different things. Or like my knee. Okay, well, I can't do a lot of deep flexion like that, repetitive deep flexion over and over again and fall down. So, or something on my knee in this particular way. I'm going to choose my left knee. You don't want to kill both knees or whatever.
Yeah.
If in dancing. No, I think pain just is allowed for moderation to come into my life more, to try to recognize the signs of when something's about to get out of control. So to make sure I see somebody.
This made me ask Paige what her other lessons have been.
How important it is to listen to those smaller signs that come up and to be an advocate for yourself. And I think that can be in so many ways in our life. How to be an advocate for your health. And I think that's what I'm learning to be. Like, no, I need that done now. And I know that that's what needs to be done.
Yeah, I guess that sounds like really learning to trust your instincts.
I think that's the takeaway. And for people to not ignore, to listen, speak up for themselves, and trust that intuition, especially if it keeps coming back.
Yeah, that's a really good point.
And I guess another thing, because we didn't talk so much about emotional pain, I mentioned a little bit of being highs and lows, but I did go through a period of it was like in the smack in the middle of school, ending a relationship and being just like crying every night. But it wasn't, I think pain is important, and especially emotional pain. While you don't want to sit in it for too long, but I do think you have to honor it. There's something about, okay, this is going on and I need to process this. I need to be in this because this is coming up. I think that happens when people are like, oh, I'm depressed, and that's horrible, isn't it? And I'm like, well, or I shouldn't be feeling that way. And I'm like, well, that's kind of creating another problem, actually. Okay, I'm having this experience, and how can I take care of it?
Paige really has a good point about what people often tell themselves when struggling with undesirable emotion, falling into that trap of thinking we shouldn't be feeling a certain way. That's actually similar to how we can get stuck thinking of all of our physical imbalances or asymmetries as a defect, when, in fact, it's all what makes us, each one of us, a beautifully shaped and uniquely expressive tree.
And people really judge themselves, and I feel like that's another piece of learning how to kind of acknowledge that and hold it and pass through it. I think I'm really a big advocate of that, to pass through that, because it will change. It'll change. It might not be tomorrow, but it will change, and you have to trust that it'll change. And so you're like, okay, here I am.
Paige has helped to raise some really important questions about trusting ourselves and advocating for our own health care and letting go of some of our baggage about imperfections in our health. Do you ever check in on that judgy inner monologue that we all have? Are you someone who downplays the significance of your pain? Or do you worry and think about it obsessively? Or maybe you do a little bit of both. What does it look like to take yourself and your pain seriously enough to get the help you need, but without letting that turn into the type of concern that might interfere with getting the appropriate degree of help that you deserve? While you ponder that and do your best to keep hopeful, how about holding on to Paige's final thought? Things will change, and you have to trust that they will change.
Change your mind.
That wraps up another conversation about everyday pain. Please join me for another episode next week with more explorations of why it hurts, how to make it stop, and keep it from happening again. If you have thoughts about this episode or you want to share your own experience with pain, please join our growing community at the Everyday Pain Forum on Facebook groups. If groups aren't your thing, you can just like and follow the Everyday Pain Guide Facebook page or check out tweets at @NoEverydayPain. Organized Sound Productions is responsible for the serious audio magic that makes these episodes work. Our theme music is by Eric and Magiel, and you can check out the other artists and businesses featured in this podcast by going to StopEverydayPain.com, where you'll find all the episodes and more. For privacy, when requested, guests' names are altered. Please also remember these episodes are never intended to serve as medical advice. Thanks so much for listening, and until next time, I hope you also find a way to connect and talk about your own pain.